So I'm going to first check the patient's chart, and I'm gonna learn everything about her. And I also noticed that she's not on any precautions, so I would put PPE on right now, but I don't have to for her. I'm gonna do hand hygiene. I also would have already gathered all my supplies. So supplies, hand hygiene, ready to go in, knock knock. All right, hi Mrs. Williams. I'm here today to insert a foley catheter for you to kind of help you pee. I know we've been having some trouble with that. So I'm gonna get you all cleaned up, and then we're gonna insert the catheter, and then we'll be done, okay? I'll try to make it as quick and painless as I can. Okay, it is gonna be a little uncomfortable, but it'll go by fast, okay? So, Mrs. Williams, would you tell me your name and date of birth?
You forgot?
Okay, very good, thank you. I'm just gonna raise you up to my height so it's easier to work with you. Okay, so first I'm going to clean your perineal area up just a bit. Make sure you're nice and clean for this procedure, okay? So I would have my basin already filled up with warm soapy water. Bring it over. Okay. All right, Mrs. Williams, I'm gonna clean you up a little bit now. Back side that I haven't touched yet. Should have only done that once. Only one straight down. That's it. Okay. Make sure I use a new side of the washcloth every time. Haven't done this end yet. There we go. Okay, looks good. I'm gonna use some water to rinse off the soap. We don't want to leave any soap there. It'd be irritating. Water. I would probably, by this time, I'd probably need another washcloth. I feel like I've used all the sides, but we'll just pretend this is a clean washcloth. Okay, now that the water's washed all the soap away, now I'm going to get a new dry washcloth and pat the area dry. Okay, get rid of this. Get rid of my gloves. Okay, so now I'm going to perform hand hygiene again, and I'm gonna get ready for the sterile procedure. So, I'm just noticing now I would have, in real life I feel like I would have remembered to do this. I would have put a pad under Mrs. Williams, because when you're giving any sort of bed bath, it gets all wet and you don't want to have to change the sheets again. So I would have already put this pad under Mrs. Williams, but I'll go ahead and put it under you now, in case there's any mess with the insertion of the foley catheter. It'll catch on this and not on your sheets. Okay, so I touched that, so again, hand hygiene. Okay, so now I'm going to open up my sterile kit. Okay. I'm gonna pretend this is not there, and now we're gonna put the gloves on. Okay, so I'm gonna put some drapes right, Mrs. Williams, can you raise your hips a little bit? And she would raise her hips. This will be here. Okay. And then I get the other drape. We're gonna pretend this is not a fenestrated drape and that it's just doesn't have a hole in it or anything. So I'm just expanding my sterile field so I have more space to work with. Okay. And my supplies. Okay. All right, so I'm just gonna get you all ready now, Mrs. Williams. So I'm taking the tube out. Just go ahead and put the lube into this little container right here. And now that I'm done with that, I throw it in the garbage. Put the tip of the foley, just like rest it in here. So it gets lots of lube on it. Now I'm going to take the iodine, open that up, get it on all the cotton balls, throw it away. Then I would take the saline solution, open it up, and connect it. I'm gonna need that in a little bit. Okay, looks good. Okay, so now I'm going to grab these, and this hand is officially going to be clean instead of sterile. Okay, so Mrs. Williams, I'm gonna do another little bit cleaning procedure with the iodine solution, okay? So you're gonna feel some cotton balls. Take this and go down just one swipe, and then we're gonna throw it away. And one swipe down the middle, throw it away. And one swipe on the other side and throw it away. And now I can throw these away. Okay, so now I'm going to take the foley, spin it around a little bit, make sure there's plenty of lubrication on there. And all right, so Mrs. Williams, I'm gonna insert the foley now. You're gonna feel a little bit of pressure. It might be a little uncomfortable, but let me know if there's any like really sharp, really bad pain, and I will stop. So just brace yourself. I'll get it done quick, okay? All right, so in it goes. Maybe not. All right.
You're in the right place. I think it's the mannequin.
Yeah, okay.
We'll just stay. I mean, you're in the right location. So.
Yeah, okay, there we go. That was a little uncomfortable, and in real life I wouldn't have I wouldn't have taken it out and then tried to put it back in, because that would have broken sterility. Anyways, okay, so so I'm inserting it until I get a return of urine. Oh, there's some urine now. I'm gonna put it in 1 or 2 inches more. Okay, very good. Now I'm going to insert all the saline solution that gets into the balloon, and the balloon's all pumped up. Give a gentle tug just to make sure that it's resting safely. Okay, it is. Okay, so this is not sterile anymore. Still gonna hold onto the tube just so it doesn't fly out. I'm gonna disconnect the saline. Going to
I figured everybody that.
put this in place. I would use a stat lock normally because that's safer and better for the patient, but we just have tape to pretend this is a stat lock. Okay. Making sure there's some slack. Taping it down. Okay, very good. All right. Connect this to the side rail, making sure there's no kinks, making sure that it stays below the bladder at all times. Okay, now I'm gonna clean up your bed area. How do you feel? Does it feel okay? Yeah, I bet you're happy that all that urine's coming out now. It looks good. here? I'll find it. Okay, here it is. This would be in the garbage already, but you know, we're pretending. Garbage, all of this garbage. Okay. I'm gonna cover you up now. Take off my sterile gloves. Throw those away. Put this back up for safety. And lower her back down for safety. Okay, is there anything you need now, Mrs. Williams? Anything I can get you? No? You're comfortable? Okay, good. So here's your call light, and just let us know if you need anything, okay? I'll be back to check on you in a little bit. Bye.